Welcome back, everybody. It is Thursday, so of course, time for Talking Kids with Dr. Caitlynn. Dr. Caitlynn Iddings, a Lexington pediatrician, is with us this morning as always. Doc, good to see you.
Yeah, good morning.
So today we're going to talk about dental hygiene in kids. Now, we've got Dylan teething still, so you know that's one of the things you have to worry about. Always, you give a kid something cold to chew on. Does that help with the inflammation for gums?
Yeah, that's what we recommend.
Yeah, we'll get him that. Yeah.
Okay, so how do you want to start today? What do you want to start with?
Yeah, so we're just going to talk about basics of dental hygiene for babies through kind of young kids. Most kids, I think 25% will get a cavity by age 3. And so a lot of people don't think about taking their baby to the dentist. And as pediatricians, it's our job to kind of help educate things we should be doing before that first dental visit. So usually what they recommend now is that once the first tooth erupts, you actually start brushing it with regular fluoride toothpaste. And so there's all of these different products out there right now that are, you know, natural toothpaste that don't have fluoride, safest swallowed, and those are fine if you're just using them before they get teeth to kind of just clean the gums, which they do recommend. You know, just to kind of get them used to having something in their mouth. You can use these little things on just a regular finger toothbrush or just with a wash rag and kind of clean the mouth after breastfeeding or bottle feeding. Try to do that at least a couple times a day to get them used to that feeling.
And don't those things bite?
Well, yeah, they can. Like I said, the finger toothbrush can be dangerous.
Yeah.
You know,
That's what I'm
when
saying,
they actually get teeth in. So
Yeah.
most kids are gonna get their first tooth around 6 months of age. Some of them will get that a little earlier. Some of them won't get them until 15 months is really what we consider the upper limit of normal. But they do recommend as soon as that first little tooth is through, you want to make sure you're using either a finger brush or a small toothbrush and just doing a smear of fluoride toothpaste. So that would just be regular kids toothpaste. If they don't seem to like the flavor, there's only about 5 million different options. You can always switch it up, right?
Well, that's what I was going to ask.
Yeah, so just a smear. And my kids were like that. They're like, that's spicy, you know, if it was like minty, so you can get bubble gum or whatever. So just a smear, make sure you're brushing twice a day as soon as they get that first tooth through, okay? That's supposed to help prevent cavities. And so the other thing, you know, in Kentucky, we have a lot of people who are in more rural parts of the state who are on well water, and well water doesn't always have fluoride added to it. If you're on city water, you do get that fluoride. But that's why they recommend you do start doing that smear of fluoride toothpaste to get that exposure and help prevent those cavities, because it's certainly been shown to help. Other things would be, you know, as they get to age 3, you want more of like a pea size on there. And then by the time they're 10, usually we do recommend that you supervise them all the way up through age 10, because a lot of them still just are not, or you know, they go in and they kind of do that, and then
My dear, I just run water over the brush. Sure, I brush my teeth.
Yeah.
You still do that?
I still do that.
Yeah. And who is checking up on you to make sure you're brushing? Is it Dr. Caitlynn? She calls you every day. It's like, Lee, be honest with me.
I would do it for her.
Would you?
It's Dylan.
Oh, okay.
And so the other thing is just practicing other good hygiene things. So the AAP recommends making sort of this brush, book, bed routine. So not brushing the teeth, reading a book, going to bed, not putting them to bed with a bottle. That can be, you know, even if it's milk in it. We don't want juice in bottles at all.
Right.
Because those sugars are just going to stay on the teeth all night. You know, they'll wake up in the night, they'll take a drink of it. We call that baby bottle teeth, where they can get really bad dental caries just from that sugar kind of constantly being on the teeth.
Right, yeah.
And so we usually recommend, you know, if you need a bottle before bed to help them calm down and soothe and fall asleep, that's great, but make sure you're brushing their teeth after and not leaving it in the bed with them. Making sure that you're keeping pacifiers and other artificial nipples clean. And then, of course, the other thing they kind of say is like, try to avoid like sticking the kid's pacifier in your mouth and then putting it in the baby's mouth.
That's how some people clean it.
Yeah, it is. But it is passing sort of your mouth flora to them. And as adults, ours is different than like a baby that doesn't have a lot of that going on.
But yeah, the earlier you start doing these things, the better.
Yeah, absolutely.
Create good habits.
Yeah, and then they do recommend, the AAP recommends seeing the dentist by age 1. Some kids don't have teeth by age 1, but we in our office say certainly by age 3. And there are some pediatrician offices that will do the fluoride varnishes for you in the office. And the dentists do kind of usually recommend, even if you have fluoride in your water, doing those varnishes to give extra protection.
Great information. Dr. Caitlynn, thank you.